Okay, I can see that we are going to have a bunch of people coming in during your lecture, coming back from lunch, and I do apologize for that, but we did kind of run them out of time, so it's our fault. Don't take it as a reflection of you. Okay. Next up is one of the women, one of the people in this field that I respect most in the world. Veronica Ortega. And you know, I didn't just say Ortega. You can't. It's not as sexy or poetic. Veronica Ortega. Veronica Ortega was a medical doctor at 25 years old. A homeopathic medical doctor, I think, with that degree at 27. An acupuncturist, a herbologist. Her credentials and her accomplishments far too vast and far too immense for me to even know how to list them off. However, as an instructor in biofeedback, one of the difficulties for me was that often I found the education and the way people approach the device to be very ADD. A little bit of this, a little bit of that here, and then over here, and then click there, etc., without significant focus. And when I came back from China implementing what I had learned, Veronica and I met when she translated for me when I was teaching in Mexico. In her school, I came in for a weekend. And as she was translating for that entire lecture, that entire weekend, she kept saying, "That's how I think about it too. That's what I do too." And it was my first experience of finding someone else as a colleague within the field as an educator who ultimately was systematically breaking things down in a way that could actually support a foundation so that no longer were you click here, click there, without any meaning behind it, but in fact you understood what you were doing. And by having that foundation, we can create. In my opinion, arguably, there is no better educator in this business than Veronica Ortega. She has taught thousands. Carolina Iberstad is one, singing her praise right there. She has taught thousands of people. They're beginner, they're intermediate, they're advanced. She's taught complementary courses. She's right now getting another degree because she didn't already have enough. She's right now getting a functional medicine degree. And this woman, in my opinion, is one of the most amazing human beings I've ever met. So, without further ado, Veronica Ortega. Now you have to live up to all the shit I just said.
It's kind of rough. So, welcome. Thank you. So, I'm kind of a little nervous because I haven't done this in 9 years in English. I mean, I keep teaching in Spanish, but not in English. So, I hope I can lecture okay. If not, be patient. I'll try to do my best. So it's funny because I haven't done this in a while, and 6 months ago, one of my former students called me and said, "Please teach us." And I'm like, "No." She called again, "Please teach us." "No, I don't do that anymore." Again, "Please teach us." So after she insisted so much, I started developing a new protocol that I was working with, leaky gut. It's not a new hearing about leaky gut, but for medical doctors, this is new thing, you know? And finally, functional medicine is approaching this. So I started developing the protocol for leaky gut, and I taught it to this small group, and a month later, I received a call from Adam. "So what are you doing?" And I'm like, "I'm working." "Are you teaching?" "No, I'm not." "Would you do a lecture?" And I was like, "Yeah, I can. I will." So that's how I got here. So
That's not true.
yeah, well, kind of.
Adam, your words were, "Thank God, I've been waiting for the energy to shift."
Well, yeah, that was it.
What you say.
Well, we all have, right? We all have been waiting for that shift. And yes, that happened. So I was kind of preparing myself for this, for the past few months doing this. So That's the only phrase I hope I didn't translate. But it's about biofeedback and health. And for functional doctors, biofeedback is a real thing. We do biofeedback, we live through biofeedback, and it's part of the therapy as a functional doctor. Okay, so we will start to explaining. Any doubts, please. Always in my classes, I first explain the disease so you can understand what's going on in the body. So then you can understand the protocol and why I did choose or not different programs in the system, or even to improve or to change the protocol to make it fit for your clients. Okay? So what's this image I love because 90% of your nutrients are absorbed in the small intestine, okay? 90%. So do you know where digestion starts? Who said brain? Exactly there. The digestion will start in your brain, and we all have experienced that. For example, like we thought this morning for lunch, maybe I would have sushi. And then something happened, and I didn't have sushi. I have to take, I don't know, a fruit or something else. Then my digestion, it's not going to be as effective as if I, in fact, would have eaten sushi. Because the minute I start thinking on what I'm going to eat, my pancreas and my stomach prepares itself to digest exactly what I'm thinking. So digestion starts in your brain. When you think of what you're going to eat, then your body starts working, okay? So see how tight is brain function to your stomach and to your intestine. So after digestion starts, the small intestine, it's going to absorb all the nutrients. But that part of our stomach is really delicate, okay, of our digestive system. And you have, do you see this? Like, oh, great, thank you. Thank you so much. So this is the villi, okay? And there's a microvilli, and this nucleus and this cell's membrane are tight, are close. They won't allow anyone to step in unless they have a specific credential. That's the function of this. And if you, you'll have all this information. If not, I will send it. But the thing is, this is the way our small intestine should look, okay? Tight. It won't let, again, anything go through unless it's damaged, and that's the problem. So now, if we make the bigger picture, this is our cells, okay? So we have bacterial products, dietary, and antigens that are not allowed, that it's not allowed to go through the barrier, okay? It's not allowed. It shouldn't be there at all. The only way it should be that nutrients will go through this sodium molecule through the barrier, because that's like their passport, you know? And if they have a passport, they are allowed to get in and nourish yourself and get into the cells and immune system, etc., etc. But when these walls got damaged because of smoking, dietary, what else? Stress, vaccines, what else? Parasites, what else? GMOs, antibiotics, everything can damage those cells. They start letting go all these things that our body is going to identify as antigens. It doesn't matter if it's gluten. It doesn't matter if it's dust. It doesn't matter if it's dairy, proteins. Our body does not recognize those things to be able to be in the bloodstream. They're not allowed to be there. So that's why we start developing allergies, okay? Because we have leaky gut, then we start having allergies. And then you go with the doctor, and what does the doctor say? You need to get vaccines, you need to take remedies, medications, but they never look on what you're eating and how your bowel is until you have like ulcers and Crohn's disease and things are really bad, okay? So this is what I love. So the approach is dig in. You need to dig in to understand how this works. First is digestion, intestinal permeability that will affect your gut microbiota, that will have everything in your body inflamed, so that's a lot of inflammation that finally will affect your nervous system, okay? So that's the way it's working. So we need to go the other way to invert this. So dig in to this to start making a change in your client's life. Okay, so this is really cool, guys, and understanding this has made a big difference in my life. Our intestines are always on fire, okay? Imagine this. Your intestine is always getting what you eat. And what you eat might have parasites and might have bacteria, GMOs, minerals, vitamins, I forgot the name, heavy metals, okay, toxicity, all the time, okay? But that's okay, because that's what your intestine is built for. Our mucus, do you know how long does it take to change your whole intestinal mucus? 5 days. And that's a science fact. I'm not making up anything. You can look into MedPub and you can see all the publications about this. So in 5 days, every 5 days, our whole intestine mucus is changed. Because it is the one that's in charge to fight all these bacteria, viruses, parasites, everything. And that's okay. There's an article that I was reading that the whole inflammation that our intestinal tract suffers in a year won't match the whole reaction of our immune system. Our immune system, it's not designed to react. It's designed to be just there in use when it is necessary, while your gut, your intestine is designed to be on fire every single day, okay? The thing is, when you hurt your intestine, then your immune system is on fire and gets confused. And that's when it starts attacking your own cells. And that's the physiopathology of autoimmune disease. Because you have a leaky gut, then your immune system gets crazy because he's not supposed to react. Now he's reacting all the time, and then he got confused. And now he's attacking bad cells, good cells, everything. Okay? Was that clear? Does it make sense? Okay. So the immune system, the intestinal mucosa is directly exposed to external environment and subjected to an antigenic charge through the commensal flora, dietary antigens and viruses. This occurs daily in larger amounts than the immune system is exposed throughout its entire life. Therefore, 90% of the time, the task of the immune system is not to respond. I put it there because I was afraid I couldn't explain it. But that's the thing. Our immune system, it's not designed to respond all the time. It's designed just to respond when it needs to respond. Next. So here's the deal. You have these cells that I love in your stomach, and there's this route through different nutrients, principal sodium, and then you have all this tight, okay? So it won't let pass anything at all. But something happened, and all of these undigested food particles, microorganisms, toxins, etc., will start coming into your bloodstream. They shouldn't be in your bloodstream. They're designed to be where? On your ECs, on your colon, out there. Only nutrients, micronutrients, amino acids, vitamins, fatty acids, minerals, trace minerals, electrolytes are designed to be into your bloodstream. Nothing else. Not viruses, not bacteria. They are designed to be out. You know that for each human cell in our bodies, we have 10 viruses or bacteria or whatever. You know that? No? Well, we're more bacteria in that approach. And if we have to weight our microbiome, it's like 1 or 2 pounds approximately. So there's a lot of bacteria there that are essential for our bodies. do you know part of our vitamins and minerals are being produced by them or activated by them, like vitamin V or vitamin K? Our bacteria will synthesize that. That's why newborns that are not, that were born by C-section, so they don't have their flora, they will bleed because they don't have the connection through the vaginal flora to start synthesizing vitamin K. So you know that. I mean, I have a 3-year-old baby, and even I did try my best. She wasn't ready to be born. So it was my 42 week, and I looked like shit. You know, because she was there, and I was like, I couldn't breathe. She wasn't calming down. I don't know what happened. Maybe I was too scared myself. But the thing is, my doctor said, you know what? She's doing great, but you look awful, so we need to take her out. And he's a really nice doctor, and I talked to him about what I wanted, and he said, that's okay. So I was at the OR, and he took a sample of my vaginal flora. Then she wiped. When my baby was born, she was inoculated with that flora, okay? And through the fields, I received my baby in the OR and started breastfeeding at that same second, like it was a normal birth. So that's what we need to start doing it in, so the babies can, they are born sterile, okay? So they need to have this contact, this flora, to make, so they can digest even our, that's why the first days of breastfeeding, we don't have really milk, you know? We have just water with a lot of defense and immunoglobulins, nothing to do with food or nourishing. It has to do with start creating the microbiome. So that's when you get to understand that, you know, a baby does not need antibiotics as soon as it's born, you know, or vitamin K shot. They need to start synthesizing their own vitamins through their bacteria. Okay, that's what they need. And if you don't do that, and you start formula on a baby, this will happen. Because there's nothing to protect the intestine. And now, as a doctor, I was taught that what has really evolved was our diagnosis. The way we diagnose, you know? It's like people wasn't getting sicker. We are getting better at diagnosing. Okay? So where I was through med school, and I will argue with my mom and my dad, who was also a doctor. I said, no, it's not people, it's sicker. It's we are better. Now we can diagnose everyone. And that's not true. We are sicker. We are seeing babies with reflux, you know, and with gastritis, and they're like a month old. Why? What's that happening? They can't digest. They don't have bacteria. So what do we need to do? Well, we need to inoculate bacteria. So the baby will start producing everything it needs to digest and to absorb nutrients. Okay? Next, please. So this is a healthy gut, and this is leaky gut. Do you get the idea? So this will have perfect feature, and these holes will start really, really microscope, you know? And then we'll go to Crohn's disease. It will start this small, and then we'll go to Crohn's disease. And Crohn's is reversible if you start doing this. Remember, 5 days it will take to your gut to heal. But you need to accomplish first what? What's the first thing you need to do? Change your diet so you can stop what? Inflammation. The key to this is inflammation. We are, and it's not that you feel the inflammation, okay? That's a bigger issue. It's the inflammation that it's systemic because of the leaky gut. You know, at my practice, because what I've been doing for this past years is studying and being a doctor, okay? So at my practice, I have a lot of patients that are with arthritis or lupus or different autoimmune disease. And the protocol that I use is to start doing this, healing inflammation. No matter what the disease is, even cancer, you need to stop first the inflammation to stop your body from attacking itself, from building proteins, acute proteins that will make you inflame and hurt yourself. And that is your body doing this, attacking you because of what you eat and because of the inflammation of your intestines. Was that okay? Yeah. Okay? So, which are the causes? Alcohol, caffeine, parasites, bacteria, chemical additives, wheat and gluten, excessive fluid with meals. And that's a common error. Please don't drink water while you're eating. Don't do that. Why? Anyone knows why we shouldn't be drinking water? You lose your chloric acid, okay? It needs to get acid so you can digest protein. So if you're drinking water, you're diluting that, and you're losing your ability to digest proteins. So please, when do you need to drink water? 30 minutes before, so you can ensure you have the right amount of chloric acid. And after eating, you need a tea. 30 minutes after you eat, you need tea, hot tea. So you can improve your digestion, improve your pancreas, and you get the enzymes for absorption, okay? That's the way our digestive system works. So don't drink water while you're eating, okay? Or coffee or tea or anything. Don't drink liquids. Don't drink at all while you're eating. Okay, before it's water and after coffee or tea. Yes. During your meal, don't drink water. What do you need for getting your meals? Saliva, not water. So drink your water before your meal so you'll have good saliva, good chloric acid, and you'll have a great digestion, okay? So inadequate chewing, that's also a problem. So what I recommend my clients is to, the big problem, it's not with proteins, it's with what? Vegetables. Why? Because vegetables have fiber. If we don't chew correctly, we won't digest properly the fiber, and they will make us bloat, okay? So just cut your veggies really small, and that will do the trick. Cut the veggies, then you chew, and then it's done, okay? We're not cows. We are not allowed to be chewing. It's tiring, you know? Just cut your veggies. That will make the trick. Like you're not as a baby, but just cut them. And then you'll chew, and it will be fine. Refined carbs, junk food. I mean, refined carbs, it's like the worst at all. So if you're eating refined carbs, always take some enzymes with it, okay? Because you won't digest them. It's really hard. Because it's not food. It's plastic, almost. Prescriptive hormones, other medications. You know which one is the worst medication for all? Not aspirin, like omeprazole and suprazole, all of those that will inhibit your chloride, your acid, so you will not be able to digest proteins anymore. And you know you need protein because you will be synthesizing every single day 3,500 different proteins in order to be alive here, listening to my speech, okay? 3,500. So we need proteins. We need amino acids in our bodies to do that. Mold and fungal toxins, you know, candida, that's a really big problem. But we can change that if we change what? The bioterrain. That's something that I learned. Instead of attacking all the time the bacteria, the parasites, the candida, the viruses, I just changed the terrain. And if you change that, they will die. They're not allowed to survive. It's easier than being confrontative to them, okay? Dental toxins, heavy metals. I mean, heavy metals, and they were talking in the morning about using clay. You said it, right? I've seen great things if you're detoxing your body from heavy metals, and clay works like a charm. I really love it. Yes. And stress. Stress can make our bodies inflammation in our bodies, because what does stress does? Raises cortisol, exactly that. So our body prepares for an attack, and cortisol will provoke inflammation. So when you're stressed, you will be completely your body will be completely inflamed, is it say? Inflamed, thank you. Help me, please. So that's something we need to change in order to see our clients getting better. And I choose this subject because it doesn't matter the disease. You'll need to do this approach. If your client, for example, is dealing with, let's say irritable bowel syndrome, just that, okay? If you don't have this corrected, you won't have the materials, the aminos, the protein, everything to repair your guts, to repair anything. So when you give the body exactly what it needs, all the nutrients, and they absorbed, the body is going to do everything. It's going to correct everything. So this is something that you need, it's a must, like in the first session or the second one, okay? Next. So hear this, 70% of the immune system is in the intestine, 70%. Other authors said 80, but I'll keep it on 70. It sounds okay. Half of the body's nerve cells are in the intestine. Half of them. So that's why it's our second brain, right? 95% of serotonin is produced in the intestine. 95%. So you know what serotonin is? Well, more than the happy is our feel-good hormone, okay? It's like, my heel break, and instead of feeling that's the worst thing ever happened, if I have serotonin, I can say, okay, my heel broke, I just put it back together, just not a great day, that's it. But if I don't have serotonin, I will feel like, oh my God, my heel broke, oh, it's the end of the world, okay? That's exactly the function of serotonin. It will allow you to go through life not feeling that you want to die. Okay, that life it's good and it's threatening, but it's okay. You know, that's the function of serotonin. So imagine this picture. Your intestine is with leaky gut, so it's not functioning. So you're not absorbing. So there's two problems. You can't produce serotonin because your factory is damaged, but also you don't have the materials to synthesize serotonin. So you're very serotonin low. So you're always stressed. So that's more cortisol. So that's more stress, more inflammation. And you keep doing that for 10, 15, 20 years. What do you expect? Well, that would be cool, but that's cool, that's easy, that's fast. Yes, metabolic syndrome, diabetes, cancer, you name it, it's their autoimmune disease, Hashimoto's disease, everything. But it all starts in your guts, okay? It is known as the enteric nervous system and represents the second brain of the human body. That's what we said. And I put the human body because we're more bacteria than humans, so who knows what we are. We're just great. Next. So imagine this. All these poor dietary choices, stress, infection, systemic disease, some stressfuls, low stomach acid, toxic exposure, food allergies will alter your intestinal permeability that will become food allergies, malnutrition, dysbiosis, molecular mimicry. Do you know what's that, molecular mimicry? So imagine your body getting confused. Your gluten cells, gluten molecules, with your thyroid cells. They are really alike. So after a long time of being exhausted, the immune system confuses gluten with thyroid cells. So that's Hashimoto's disease. And it all starts in leaky gut, gluten intolerance, immune system being attacked, then confused, then your own immune system will start attacking your thyroid. And you will go to the doctor because you're feeling really tired, and they'll say, hey, your limits are okay. There's nothing wrong with you. Go to the psychologist, psychiatrist, whatever you want to go, you know? And the problem is there, and after 5 years of this, 3 years, it depends on your body's information, you will end up with Hashimoto's disease or Graves' disease. It depends on your genetics and other things, but more or less it's the way it goes. So that's mimicry. And it will not only happen with your thyroid, it will also happen with your bloodstream cells, with your adrenals. So are you getting the picture? Okay, toxic overload, so your body is just out of it. And then you have elevated total of toxin and antigenic burden, and then it's just systemic disease. And then you have all these different doctors trying to approach the problem with different things, but they are just approaching symptoms. They're not understanding the whole picture. And it's weird because all this information is in the literature there. I'm not inventing anything. I'm not making it. It's not what I think it is. All of these are in medical publications. Okay, all of this. Nothing is in my mind. Well, not now. It was before, but now I can talk about it because I have proof. Okay? So all of that, gluten, casein, toxins, will increase the intestinal permeability, will produce inflammatory factors, inflammation, cytokines, more inflammation that will increase intestinal permeability. So you have allergic, autoimmune, and other systemic pathologies. And it's really easy to measure that because you can do an analytic, with PCR. That's an acute protein that your body will produce when there's a lot of inflammation, okay? So we used to see those PCRs getting up high numbers after heart attacks, or if you do this a lot of exercise like a marathon, you will have those proteins because running a marathon is a stress thing to do. It's not a healthy thing to do. You know that, right? It's not a healthy thing to do. At that moment, you're pushing your body a lot. So that's a stress. So that's cortisol. That's inflammation, okay? So in those cases, we were used to see PCRs up. Now, with diabetic patients, high blood, cancer, and a lot of different pathologies, we're able to see PCR numbers getting up and up. Yes, the C-reactive protein. Yes, the C-reactive protein. PCR for us in Spanish, sorry. But yes, it's the C-reactive protein. And you'll start seeing those numbers go up. And the doctor will see all the different numbers, glucose and everything else normal. And they'll say, okay, you're fine. And I'm like, no, there's something indicating you inflammation. Maybe you're doing sports. And I'm like, no, most of the patients don't do sports. They're not running marathons. You need to investigate why is that reactive protein getting up. When they realize it is 15, 20, that's really high, and the the client has cancer. But they were warned years before with that protein. You see, that's another thing that will complicate everything. Your liver now is busy synthesizing these acute proteins. So now he's not synthesizing other proteins like albumina albumin that's for transportation. So that now there's nothing to transport nutrients, and that will increase inflammation and liver disease. Are you getting the picture? So it's getting complicated. And it's easy to see it in the labs. It's not as hard. We just need to interpret. Okay. Next. So once again, imagine this is your body taking minerals. So this is your body synthesizing vitamin K, also vitamin B. This is going into your bloodstream. Then you're healthy. Everything's great. But if your body is with all these medications, infections, stress, then all of that will go into your bloodstream. And the consequences are negative food reactions. So it's not the gluten, it's our body, it's our intestine that it's allowing the gluten into the bloodstream. Okay? The gluten, it's not the bad guy. It's our intestine that is allowing the gluten into the bloodstream. The same thing with the dairy and the soy. Okay? Compromised immune system. So you can see allergies, asthma, eczema. Do you see these little babies, a year old, with these huge, awful eczemas? And it's because of the dairy, of course. But it's because they have this problem. Their intestine is damaged, okay? Nutrient malabsorption and vitamins D, K, B12, magnesium, all of that will translate into Hashimoto's, multiple sclerosis, arthritis, inflammatory bowel disease, lupus, cancer, you name it. And this is the same physiopathology. Okay, that's why it's so important, because it doesn't matter the disease, it will have the beginning or the core is in your guts. Does it make sense? Are you remembering patients, clients, symptoms? Okay, so once again, these lipoproteins, I love physiology. These lipoproteins that were not allowed to get into your body, now they're in the bloodstream, okay? And they can affect liver, muscle, adipose tissue, and your hypothalamus. And then you're in trouble, okay? Because now your whole system, it's not functioning okay. So it's going to be, you're an easy target for a parasite, for Lyme's disease, for a virus. Okay, it's not that viruses are getting that super viruses. It's your body is super crappy. And it's not able to defend yourself. Okay? I mean, we know about resistance that our bacteria is creating because of all of the things we're using. But we also need to recognize that our body, through the years, through thousands of years, has evolved, right? So we should be prepared to fight this. Why aren't we not prepared to fight this? Because our system is crappy. It's just too weak. It's confused. It can't do it. I love vitamin D, and I think it was yesterday they were talking about vitamins, right? So do you know in the States, it's 80% of the population has a vitamin D deficiency? And we're talking like they have 16 nanograms, and that's nothing. Because the optimal rates we're looking for, it's 50 to 80, not 30, 50 to 80. Because you know, some great things that the vitamin D does, it prevents cancer, specifically colon and breast cancer. So we need to take vitamin D? Yes, we do. Why? Well, not just to prevent cancer, but do you take sun? Do you go out in the sun? Exactly. You know how many vitamin D do you produce every day? So if you go out in the sun for 20 minutes, you will produce 10,000 universal units, okay? 10,000. 20 minutes. It's not that long you need, but who does that? Well, Maybe some. I'm not able to do that. I live in Mexico City, so it's hard to do that. And it's a really, really busy life in Mexico City, so I'm not allowed. I don't have a lot of time, so I don't do that as long as I would like to. So I take supplements to improve that. So now my levels of vitamin D are finally getting really close to 50, but mine were 17 2 years ago. And I'm taking supplements, I'm doing things differently, and I'm not yet into the 50. Because my body was really, really with an inflammation process, okay? So you need to take in counter of that. The first time you will start using supplements, you won't see immediate reactions because you're gonna be using all of those vitamins and minerals to start healing and stopping inflammation, okay? So you will have, and you say, I'm taking all this, why it's not working? Well, just give it a time. It will kick in and you will get those levels. No, it's not. Mushrooms has such a little amount of vitamin D. And if you have all the vitamins that you get from the vegetables are not available for man. We need to activate them through the liver. So if your liver is not working because all of that, you might take all the veggies you want, all the juices you want, and you won't be able to obtain, because your liver won't be able to transform it, okay? I know veggies had all of this, but if your liver is not working, you can't make them available for you, okay? Yes? Well, that's part of it, but the thing is your liver will activate all the vitamins and transform it for animals. It's not the same, the veggie vitamins, that the animal vitamin, okay? I'm looking the word in English, but I can't find it. What? No, not fast. Biodisponible? Bioavailable, thank you. So it's not bioavailable. You can use it. You need to activate it. So in order to do that, that's the job of the liver. So when you're with this, your liver is not working. So that will also improve and will make more inflammation. Okay?
But if you have all these things and you have malabsorption issues, you take supplements, are they really going to be absorbed and assimilated properly?
She says that if you're taking supplements with all of this inflammation going on, will you absorb supplements? Of course not. Not all the way. That's why you need to take really high doses in order so you could get a little bit absorbed and you start doing the changes. That's why biofeedback will help a lot. And that's what I'm going to teach you in a few minutes, how to make this start. And you know what I love? You can train minerals and nutrients so you can improve that condition a little bit faster than just using supplements or food. As they were talking yesterday, we need to have a good diet, but also we need to supplement that diet. Unfortunately, we cannot live without supplementation anymore. Why? Why is that? Because our ground is not nourished. That's one of the reasons. So you're eating, I saw this article that said that potassium in a banana is 60 times less than 20 years ago. 60 times. And I was like, oh my God. So it's more sugar. So you need to have more bananas, and that will be not good because there's a lot of sugar in a banana in order to get your potassium, okay? That's one. And what's the second one? We need so much more. Why? Why do we need so much more than 20 years ago? Well, stress, toxins, environment, pollution, etc., 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 etc. Okay? So that's the two main reasons we need to have a good diet and a good supplementation. We cannot live without it. Okay, and this is me, like 10 years ago, 15 years ago, I used to say that supplementation was just really expensive urine. Yes, that's what we're trained to, and that's what they taught us, okay? Really expensive urine, but it's not it. We need to do that. Okay, so these are all the diseases that are into relationship directly. All of these, there are studies that relate permeability of the gut with psoriasis, asthma, fibromyalgia, lupus, Crohn's disease, ulcerative colitis, Hashimoto's, type 1 diabetes, okay? Rheumatoid arthritis, pernicious anemia, all of these syndromes that they were so rare when I was a student. They were rare. Now these are really common. Every single day we're meeting people. We are having people in our practice with one of these, right? Do you recognize all this? Do you see their schizophrenia? Okay, so this is really interesting. There's a doctor, I just forgot her name. She's a female doctor, a psychiatrist, that is healing schizophrenia through diet by repairing the gut. While there's a lot of serotonin and there's no more inflammation, then the brain repairs itself. And there are no more inflammation and emotions kicking, because all of the neurotransmitters are affected. Dopamine, serotonin, if you're with leaky gut, first, no absorption of nutrients. So you can't have your neurotransmitters imbalance. Second, you're not having those to stop inflammation and to stop brain degeneration, okay? So that's why schizophrenia, Alzheimer's, Parkinson are really related to these problems and these diseases. Also, with vitamin D deficiency. Why vitamin D? I didn't finish before, but vitamin D will make your cells become really specific. You know, that they make your cells mature in a good way, so they won't become degenerated. Okay. Not atrophy, but they need to be, your cells need to be really specialized and specific in order to work. If there's not a good specific function, then the cell can be easily changed and become an ill cell, okay? So that's why we need vitamin D. Vitamin D will make your cells to become really specific cells, mature cells, in order to do their jobs. So you need to beware of all of these needs. I take 5,000 now, but I started with 10,000 a day. Now I'm taking 5. But you can do the test, and if you're not doing the test, you should all start taking 2,000. Like, that's the minimum that I will recommend for any of my patients. And that's if they're healthy. So I always use 4,000. It's really hard to get too much D because we're using it, but it's liposoluble, so you might have a toxic problem, but you have to take so much more, so it's really hard. It's not the same with vitamin A. That's easiest to get toxicity, but vitamin D is really hard. Well, it's hard to say because it would be the inflammation of the liver. Okay, and yes. Well, you can just get a test, and if you're into the 50 or 80 nanograms of vitamin D, you can have a lab test, and if you're there, then you just need to take 1,000 or 2,000 units every single day. And if you're below that, then you need 4. And if you're really below that, you need 6,000. So it's not that hard. But we all need to take a little bit of vitamin D. It's not enough in fish, and it's not enough in mushrooms. It's really, really, really little. Next, please. So this is the truth, what happens after all of this inflammation. Your microbiome will get more pathogens, more inflammation, and there's no way that your commensals and your symbionts, the good part of these bacteria, will be able to fight this. Okay? So if you, by any chance, need to take an antibiotic, what do you need to do after that? Probiotics. But after that, I mean, you take the medicine, and 2 hours later, you need to be taking a probiotic. Okay? 2 hours later. What not before or after? Exactly that. So you give the medication, the antibiotic, so you let it work, and then 2 hours later, after the peak of the medicine will go into your body, you'll start nourishing all the good bacteria that you just killed too. Okay? Yes, after every dose. If you don't do that, what's going to happen after a week of taking the medicine? You will end up with leaky gut syndrome. You will end up with dysbiosis. You will end up with a lot of these symptoms. And then your client will go to the doctor, and what would they receive? More antibiotics. So do you see the picture? Okay, next. Yes. Sure. Well, yes. I mean, they're always they're spores, and the thing you need to see in a probiotic is that it's more than 4. Like if you have 6 to 7 different type of bacteria, that's what you need to be. That you need millions or billions, like thousands. It's not enough, and that's it. They don't need to be like alive. Why do we like kefir and all of that? Because there are symbionts. There are different types, and they will have this pH that will help also and will nourish other bacteria. But probiotics can be in a capsule. You just need to be aware that you need different types. So if you just have 2 strains, it's not good. More than 4, I look for 6, for 8. Now we have ones that have 16. Maybe that's too much. I will love between 6 or 8, that's okay. And millions or billions of units. If it's less than that, it's not good enough. Like medical doctors will use, in Mexico we use someone's called enterogermina, that's one, but it's only one type of probiotic, and it just have thousands of units, so it's not even worth it, I think you need both. If you're taking once you repair your gut, you can keep yourself with kefir, with other things that you prepare, kombucha, I don't know, all of that will work. But in order to get to that point, you really need to take a pill and the kefir, and then after 3 months, you'll see things working, and then you can go only with kefir, kombucha, or whatever you can prepare at home. It will work, but it won't work for the first time, okay? So this is how it works again. You get the diet you have microbial composition, and you can go either 2 ways. Symbiosis, and you will have homeostasis, and everything will be great. Or you can have dysbiosis that will make immune dysregulation, inflammation, and will all this be affected by all of this, okay? So this is why you need early colonization by the mother. So if the baby, so you can ask your client how he or she was born. That's a main question. And besides trauma or everything that also counts is I need to know how his flora was built. Because normally, if it was a C-section, no one took the time to reveal that flora, right? No one. Or even though it was a natural birth, what do doctors do? They wash you up like you're... that's so stupid. I mean, like, you know? But they wash you up, or they give you these antibiotics before the birth, so there's no bacteria in your vagina. And I'm like, okay, so that wasn't a great idea. So that's important. So where the baby was born. Now there's a tendency that's called humanized birth, okay? So in that, you're in a hospital, but they won't pressure you. There's no one cleaning anything. It's just the baby getting to this world natural. And doctors, they will kick in if they need to kick in. But if they don't, they won't. And they will let things happen the way they were supposed to happen. Because we realize after all of these years that natural is better. Nature is wiser than us, so let it be. So that's an important question to ask your clients about how they were born, if they took or not probiotics or anything similar, if they use a lot of medications when they were kids, because all of that will change your microbiome, and that will make you vulnerable for developing all of these problems. So that's very, very important. The first thing I do to every one of my clients, no matter the disease, is go into probiotics. What's the best time to take probiotics? Empty stomach. So when's the first time? Well, sometimes I just say my clients, it depends, because I have a lot of people in Mexico City that wakes up at 6, and by 6:30 they need to have breakfast in order to go to their jobs. And just half an hour, it's not good enough. So I prefer, when they are so busy in their schedules, to have their probiotics 1 hour after dinner. Okay, that's also an empty stomach, and it will work. So you need to be at least 1 hour for those probiotics to really kick in into your guts, okay? So if you're not going to have the time to let your stomach use them, better take it at night.
I learned to take probiotics on an empty stomach, but more and more I'm hearing and reading on the bottle to take a probiotic with a meal. Have you seen that?
Yes, I've seen that. And last week I was at a congress, a Latin American Congress of Nutrition, and we were talking about microbiome and probiotics. And they did a study that showed that if you take your probiotics with your food, it will improve your digestion. And that's okay. But we just don't want to improve our digestion. We want to colonize the colon again. We want those bacteria to get in and say, hey, I'm home, and start doing things, not to be lost in the digestion. Okay, so it has to be, what do you want? You need to inoculate, or you want to improve digestion. Both are okay, so you decide. But if you're in a treatment to inoculate, well, just do it on an empty stomach. First of all, you need probiotics, and then once you restore that, then you can have prebiotics, and that's kefir, kombucha, and everything else. Vinegar, cider vinegar, apple vinegar, it's great as a prebiotic. Yes?
Fasting in the morning.
Oh, fasting, it's another subject, but yes, you can do it when there's a lot of inflammation. I don't recommend fasting, because it will provoke more inflammation. Your body is dying. Your body needs nutrients. And then you go fasting. Okay, so that's not a good idea. If you're already dying, if you're not nourished, you don't need to go fasting. When it's good to fast? Is it good to fast? Of course it is. But if you're not healthy, if you're not well nourished, if you had that problem, you don't have amino acids, you don't have vitamins, minerals, so the worst thing you can do is fast, because you're going to die faster. Does it make sense? Think about it. You're really out of nutrients. Why would you fast?
I want to support that. If you have parasites and you're not eating and you're fasting, your parasites start to eat you.
Yes, and not just your parasites, people. Unfortunately, like 5 months ago, my cousin, a really young age, she died, but she was eaten by her bacteria. She had kidney failure, and of course I wasn't her doctor because I'm a crazy doctor. So she was at the hospital with all these cool doctors, and I kept telling them, "You're killing her." No, and I'm like, "Yeah, you're killing her. Her bacteria is eating out her intestine. That's why she's bleeding. She has no cancer. She's just eating herself. So that's what happened. Her own bacteria had no food because she was not taking any with the diet and all the shitty things they do at the hospital, and she died because of that. So it's not just the parasites. Your own bacteria will start eating you because they need to eat. You need to think as your bacteria. I like to think our bodies as the complete universe, okay? And each organ is a planet, and each cell is a living one of us, you know, each cell. And bacteria is one of us. And they're going to think about their own good, you know, because they need to survive. We do that. Our bacteria will do the same. Our viruses will do the same. Our cells will do the same. And why they do that, that's why they became cancer cells. Do you know how cancer works, right? It's really easy. Your cells are oxygen dependent, okay? So when there's no oxygen, because you're completely oxidated and toxins and all of that, your cell will change the metabolism from oxygen to no oxygen. And that's cancer. And it's just the cell trying to survive. Does it make sense? You need to, I have a really good lecture on that, but that's not the theme today, but that's what's happening, okay? So we need to change that. There was another question back there, and I will go back. Hi, miss? Okay. So what's dysbiosis? Have you heard of this? Raise your hands if you have heard this. Dysbiosis. Okay, so gut dysbiosis is where there is an imbalance in the presence of the beneficial and pathogenic microbes in your gut. So there's a subclinic infection in a patient, and it can be presented, this is very important, as dermatitis, and the same microbiome imbalance can be manifested in another as peripheral neuropathy or arthritis. You see? So different types of dysbiosis will be attached to different types of diseases, and that is because there's different types of bacteria. When you take an antibiotic, it will kill just a sector. I make this reference. Imagine this city, and there's a disease that kills only doctors. Okay, so there's no doctors. Now nurses and I don't know, architects are going to do the job of the doctors. It doesn't come out well. So that's what happens when you take an antibiotic. You kill part of your microbiome, but it will duplicate. So a cell, a bacteria that used to be a good one, when there's a lot of them, it's not that good, and it becomes bad. Okay? That's what happens. Just one before, please. So when there is dysbiosis, it is important to be aware that you're having a pathogenic response to a non-pathogenic microbial. That's the key. That's why it is so hard to restore the balance. And that is why sometimes it is so hard to fight an infection, because you're having a pathogenic response to a non-pathogenic microbial. That's the key. Now, so what are the symptoms we're going to see? Diarrhea, nausea, flatulence, unpleasant taste in the mouth, belching, pain in the abdomen, abdominal distension, and decrease of the appetite. So it sounds like an every single day problem to a lot of people, right? But it's a really, really, really important thing that you start addressing this. With probiotics, of course, with changing a little bit of the habits, with changing a little bit on the diet, and of course with biofeedback. Okay, so these are consequences, and I forgot to translate that. I'm so sorry. So what are the consequences of having these problems is immunosuppression or activation of your immune system. So otherwise, you're really, really weak to fight an infection, or you're having an autoimmune disease. The other is inflammation. All of these different pathogens in your body and bacteria will synthesize specific toxins. If there's a lot of one, that will make inflammation in your body. And of course, it will increase leaky gut. Because bacteria defend your cells, our cells, from all those gluten and parasites and limes and things that we eat, and we don't know we are eating it. So, is there a solution to all this? Yes, there is. So what it is, first of all, probiotics, prebiotics, enzyme preparations, symbiotics, and sorbents. The thing is here, I always teach to my patients, like my treatment is really, really hard for 3 months. The first 90 days, they hate me because I really do a really hard diet. You know, I really need to eliminate a lot of things. But then, I mean, life is good. We're here to enjoy it. And food is a big, important part of life. So my first recommendation is don't let the inflammation progress. You see, right now, for me, it's vacation. It's not home. So I allow myself to eat things that I will normally won't eat at home. But I always eat them with my enzymes, because I'm not going to provoke an inflammation just because I want to enjoy French toast. It's not worth it. So what do? I just don't eat a lot of things that I shouldn't be eating. I eat a little, and I always take enzymes. So enzymes will help me to digest that, or even probiotics will help me to digest all of that, and I won't be having inflammation and all of this going on. And that's something we do. We start feeling inflammation, and what do? Nothing, because it's not that bad, right? So after that, what happens? More inflammation and more inflammation until it's really, really bad. So don't let inflammation move on. Stop it immediately. Or even better, prevent it. So find in a natural store some enzymes and always carry them in your purse, in your bags. You know, and if you're not eating at home, if you're not eating what you usually eat, take some enzymes, and you'll see the difference in your digestion. It's amazing how quickly it works. Okay. So we're going to see the protocol, really. We need first to what? Remove what's causing the inflammation and the problem. Here, I will talk about, you know, food. I mean, we need to remove gluten, we need to remove dairy, because those are what? It's really allergens, okay? But maybe it might be broccoli for you. I have a saying with my patients, if I recommended broccoli or lettuce or whatever veggie or food that I recommend, and you feel inflamed or bloated because of that, don't eat it. As easy as that. Well, they say broccoli is good, so that's what I eat, broccoli. Well, it's not good for you if you're getting bloated. That's it. So everyone's eating, I don't know, lettuce or celery or whatever. If you're getting bloated, please stop. It doesn't matter if it's a superfood, if it's the best celery in the world. It's not good for you if you're getting bloated. Does that make sense? So stop eating things that your body doesn't like. Replace. What do we need to replace? Nutrients. So that's where the supplements got in, okay? Re-inoculate. That's about probiotics. We need to make good flora. We're not using the term flora because they're not flowers or veggies. They're bacteria. So that's why we're changing bowel flora to microbiome. That's the name now. Repair. We need to repair your intestines. But you see, it wasn't the first thing to do. Repair is number 4. Why? Because if we don't remove, replace, and re-inoculate, we won't be able to repair anything. Okay? So first remove, then replace, then re-inoculate, and then we can repair. And finally, at last but not least, rebalance. And that's when biofeedback got a lot of things doing it. But also, what do we need to do with our clients? Why did they get to this thing? Because it's not pleasant to be bloated. It's not pleasant to feel stress and inflammation and feeling pain. Why do they get there? Well, they didn't know any better. That's one of it. But also, they didn't stop it because they were so busy working, dealing with stress, money, that they just kept having pills, you know, for the pain, for digestion, for gastritis, for everything. And they didn't stop to listen to their bodies and what was happening. They didn't even went to a doctor. We can't blame the doctor because they didn't went to the doctor at that point. They did what a lot of us does, that's self-medicate, right? So they did that because they didn't knew better, no, because they didn't listen, right? So that's what we need to rebalance, show them that they need to take time for themselves, that they need to learn about self-care, that they need to attend biofeedback, not because they're ill, but to prevent, to take care. We need to taught them that. We need to teach them that. Because after we all repair these beautiful things, if they don't learn to do that, what's going to happen? In 5 years, they will be back at your practice with the same problems. Or worse, because it's even easier the second time to get sick. Okay? Got it? So now I think, okay, this phrase, I love it, and now I'm going into the protocol. But you all know these phrases. Let your food be your medicine, and let your medicine be your food. And that was said years ago, okay, by the father of the medicine. And you know, the definition of diabetes, like diabetes insipidus and diabetes mellitus, was defined by him. It was him. He tasted the urine. So insipidus, it didn't taste, and mellitus, it tastes like honey. Thank God we don't need to taste that anymore. But imagine, I'm telling you, years, thousands of years ago, that was a disease, that was something in there, okay? And we're still suffering of that. So we need to learn how to eat. It's not a new disease, it's just getting worse, okay? And the second thing, it's how I like to define myself. The doctor of the future will not give medicines, but will make his patients interested in the care of the human framework, in their diet, and in the cause and prevention of diseases. So when I heard that, I defined myself, I'm a doctor of the future. So I'm going to go really quick on the protocol, but I really want you to understand all the science and all the physiology behind it. And the protocol, you have it there, and it's easy to follow, and there's my email. And if you're a little bit patient, I will always answer my email, but sometimes I just get a lot of emails. So if I don't answer in a week, please resend. Yes, in the flash drive, you have the protocol completely. Okay, so I'm going to go fast on the protocol, but I really wanted to show you how the disease is going into your bodies. So we'll just go to the next part because that's.
Sorry,
was there some question?
no, not on the flash drive. After the conference, we share all of the protocols and everything.
Okay, after the conference, sorry. But you will have it, okay? The next one, because that's the beginning. You know all that. Okay, next. You know all that. I want to approach the cool part there. Just go a little bit back, there. Okay, so when we're going to start the repair of the gut here, be really careful on doing this. This is a 2-hour protocol. I don't like to stay that long on my patients because my sessions are for an hour. Every hour I'm running different clients. But in this, I really need to spend a little bit more because I need to do the 5 hours in one session. And it is possible if after the session you keep all the nutrients and all the good things like the fiber and probiotics, then you're allowed to do all that. I'm not killing. I'm not doing a lot of sap to kill bacteria. I'm changing the environment so they will die alone. I'm not getting into a fight. I've learned after all these years that I don't need to fight them. I just need to push them out. Yeah, that's what I need to do. Like, I welcome you to live. And they will go. Because there's no space for all of them. So it works really, really good. So when you do that, please, when you start doing a nutrition, be really assertive of reading specifically the nutrients that your client is asking. Read on the deficiencies, all the unconsciousness suggestions that is asking. So I put vitamin A, vitamin C, vitamin B, B5, like the more important vitamins that your body needs. But if your body is asking for something else, if the client's body is asking for some other nutrition, please be sure to give it to your client because you will be amazed when you have these micronutrients. Great things happen. Have you ever heard that if you're tired, what vitamin everyone recommends? Vitamin B. Do you know why? Well, besides the gut, do you know why vitamin B will give you energy? It's really easy. Vitamin B will start your Krebs cycle. And without vitamin B, we cannot synthesize ADP, that it's our energetic coin. It's like our gasoline, you know? So that's why we need vitamin B. And our body is so freaking intelligent that we have bacteria to synthesize that because, you know, vitamin B, it's only in animal protein. You can have complete vitamin B on veggies, but it doesn't matter. If your body is full and complete, you will have enough bacteria to synthesize vitamin B. More of B2 and B3. Those two are the ones that will start Krebs cycle, and you will start synthesizing ATP. So that's why if you're tired, they recommend vitamin B, and it works because of that. So it's not that what do you need to do? Not just inject yourself with vitamin B. You need to heal what? The bio, your guts, in order to your body to synthesize vitamin B so you can be producing ATP. Without ATP, we're dead. We cannot function, okay? So this is really important. Vitamin B or any other vitamin that your body is asking, besides the one that I recommend during the protocol, please be sure to address all of the different nutrient deficiencies that your body is asking. Believe me, it won't be too much. It won't be too much. Yes, in the protocol, it's shown one by one how to do that. And we will go vitamin C, vitamin B. B5 is very important, so that's why I put it in part of the protocol. But if you're showing B1 or B2, please be sure to address that either. Also, you'll have to deal with protein digestion, not just carbohydrate and fat digestion, because you need macros. Okay, the way that I do it with the numbers, because that's a lot of going on with the numbers, and the way it works for me, and every single time, if the number is really low or really high, I will treat that, because both of that means it's not enough. Why it will mean it's not enough if the number is low or high? Let me explain. If it's high, for me, it's asking of a really, really high necessity, acute. Like right now, the body is really in an acute necessity. If the number is really low, then the necessity is chronic. It's being deficiency for a long time. And I've been doing testing my patients, and it was accurate. Like for vitamin D, it's like the easiest one, okay? So I ask my patients to get tested, and I see the number in the screen. So if the number was really low on the blood test, the number here was really low, and that will confirm my idea. And if the number wasn't that low, then the number was high. The deficiency was acute. So it's more than it's an acute or a chronic, but it's always a deficiency. Okay? Yes, the chronic will be below 50, and the acute will be up 100. Okay? Does that make sense for you? Well, that worked for me, and I did it, and I did a lot of research with vitamin D, because in Mexico, that's the one that's available and affordable. It's not as expensive as other panels. So I ask my patients to do that. I run the test, and every single time it worked.
So, for example, let's say you're doing vitamin D. Mm-hmm. Do you hit each of the vitamin D1, D2, D3, or do you hit the balance, nutrient balance?
A balance. I will go with balance unless there's a really low or high number in vitamin D in the panel. So you need to address, it's easier always to do the nutrient-energy balance, because you will assure for a balance, okay? The difference with D1, D2, and D3 is D3 is the active one, okay? So we all have in our bodies D1, D2, and D3 is the active part of vitamin D. That's the one we use, okay? So it's easier to do a nutrient-energy balance, but if there's a number really low or there's a number really high, be sure to address, besides the nutrient-energy balance, the highest or the lowest number. If the numbers aren't that high or that low, nutrient-energy balance will do it for you, okay?
And how long do you do the nutrient balance for, usually?
Normally, I do it until I get a rectification, and I keep getting in every single time for a few weeks. And of course, after 3 or 4 weeks, I don't need to click anymore. The body will start kicking in, and it will, and I will go and I move to other things.
Is there a way to tell excess in a vitamin?
Well, it's really, I've never concentrated myself in excess of vitamins, because it's really hard to find it right now. You know, people are not getting enough. So really, I have not seen excess of vitamins in any of my clients for the past few years. So I haven't really looked at it as an excess, you know? But I'm concentrated on deficiency, because 80% of people has it. So I guess you might find maybe an alarm reaction when you're testing a vitamin, and you get an alarm reaction. Alarm reactions talks every time about excess. So I think that would be some way that you could think there's a vitamin excess or a mineral excess or anything in excess.
May I just ask, do you start with, let's say, like an amino acid, since that's the building block of everything?
No, I start always with the micronutrients, and then I'll go to the macros, because the micro will metabolize the macro. Without the micro, you can't get macro. Without the micro, you can build anything. Even though you will have, let's say, lysine, if you don't have sulfur, you cannot build insulin. Okay? So it's always micronutrients, then the macro, and then you'll have your wall or your hormone or whatever you need. Yes, in the protocol, I did it in order. First the micronutrients, then the macros, because that's how it works in your bodies. It's really, really hard to say, what do you need to take, micro or macro? You need to take them both. But always, the micro will work with the macro. And without the micro, you cannot make the macro do anything. They will be like waiting for someone to tell them what to do. Okay? They need their general. I think, yes. Once again, remember, first of all, we need to what? Repairing, it's at the end. Digestion would be the last thing. You can't repair digestion if you don't have micro and macro to do that. I mean, remember, your digestion works with enzymes, hormones, movement, and for that, you need micro and macro. Without that, you cannot do anything. So you can imagine everyone's always talking about fiber in order for your movement of the bowel, right? Well, yeah, that's cool, but fiber, it's not a nutrient. As you know, we cannot digest fiber, so that's why it will make your bowels move. But if you have lysine, that's an amino acid, lysine will start the movement of your bowels. Lysine. Thank you, lysine. So instead of eating like your rabbits or cows, have lysine in your bodies, and then bye-bye constipation. Because lysine is the amino acid that will start the movement on your bowels. Okay? Well, that's an amino acid. So in food, lysine, it's an amino acid. Proteins like beef, eggs, like beans. Sorry, it's a protein. So in every vegetable protein or animal protein, you'll have that. It's the most important amino, and it's the more abundant one in the food.
Have you found that when you eat bran or something or roughage like that, and something has leaky gut, that it then could really run into some major emergencies?
I'm sorry, what? If I run what?
Like if they're eating fiber
Uh-huh.
and they have a major leaky gut problem, that if the fiber will push the poop out the intestines.
Well, if yes, that's really, really interesting thing. I'm out of time, so I'm gonna be quickly. I'm sorry, I'm out of time, but that's what I don't like fiber, because you have all these people that are bloated. Okay, so they go to the natural store and they will buy anything with fiber, and they will start taking fiber, and they will be worse, and all of their symptoms will be worse. And that's because of what she said. All the fiber will move all the poop that it's there into your bloodstream if there's a leaky gut. You don't want poop and toxins into your bloodstream. You don't like that. You don't want that. So don't use fiber, use lysine. Eat proper. So that's because, so I'm sorry, I need to really go. So was that okay? So first micro, then macro, then you repair. And that's every single time. Without micro and macro, there's no chemistry in your body. There's no physiology. There's no metabolism. So micro, macro, then do whatever you want. Okay? So thank you so much. I had to go. I hope you enjoyed it. Thank you for your patience. I'm sorry for my English. I will improve it.